Thank you very much, Jim. That was terrific. Our next speaker is Katherine von Stackelberg. And Katherine is going to talk about the value of information to inform decision-making under uncertainty, which seems to link pretty well in with Jim's last talk.
Well, thank you so much. And I guess I'm not really sure if I have any slides either, although they're in my bag. So we'll see. I'm actually going to talk a little bit about those unknowns and some statistical techniques and approaches that can help inform whether it makes sense to collect more data or whether it makes sense to go ahead and bring something to market or whatever. It can be applicable across the spectrum of decision making. And really, we call these techniques value of information techniques because it really quantifies the value of the information. It allows us to prioritize where additional investment is really going to lead to maximal benefit and identify those areas that have the greatest likelihood of influencing clinical practice. So what we actually do is quantify the opportunity loss from decision making under uncertainty by estimating the value of getting this additional information. And so we need to know something about costs, we need to know something about benefits, and benefits are typically the kinds of things we've heard about: improved outcomes, utilities, qualies, dollies, anything that leads to an understanding of how that outcome is going to be improved. So the approach relies on Bayesian statistics, which can be a frightening term to a lot of people. Bayes' rule it's really great because it's conditional probability, and it really contrasts against sort of traditional hypothesis testing. The easiest example really is a clinical example. Somebody goes in for a diagnostic test. The test is 99% accurate in the sense of sensitivity and specificity. It will pick up 99% of the true cases, and in people who don't have the disease, it will be 99% of the time negative. And important, you have to know this, what is the prevalence in the population? About 1% of people in the population have this disease. And so you go in, you get your test, it comes back positive. What's the probability I have the disease? Well, you think, well, it's like 99%. That's, you know, sort of the intuitive answer. But Bayes' rule, which is this conditional probability, tells you that it's actually more like 50%. So it's a really powerful thing. And in terms of traditional hypothesis testing, where you go into your clinical trial and you got your P levels and significance levels and so forth, what that's actually giving you is the probability of observing those data given your hypothesis. But what do you actually want? You actually want the probability that my hypothesis is correct given the data that I have, so that you can then say things like, there's a 90% chance that the net benefit of this protocol or this intervention or this treatment will exceed that of the other. So that's Bayes' rule. In the context of value of information, what we are essentially doing is calculating the probability of the expected benefit of that future study, whatever it may be, given what I know today, what the existing clinical data show you. So it doesn't matter what the decision is: buying a car, bringing a drug to market, going from phase 1 to phase 2, more in vitro versus in vivo, whatever it is, you want to make the decision that offers the greatest net benefit, of course, given some constraints. We don't have unlimited resources and that kind of thing. In any decision, no matter what it is, there will be uncertainty in those inputs to the decision. And what this technique does is calculate the expected cost of that uncertainty, which is determined by the probability that the decision, given you what you know right now today, will actually be wrong, and as well as the consequences of that wrong decision. And when you put that all together, you get an expected value of perfect information. Extend those techniques a little bit more, and the math, you know, does get a little bit hairy. So I would say, well, gosh, why isn't everybody doing this all the time? This seems so straightforward. Well, yes and no. There's no off-the-shelf software. You know, it does require a little bit of math. But once you have it, you have the expected value of perfect information, and when you extend these techniques a little bit more, you can actually get the expected value of imperfect information, which would be sample information. So calculating optimum sample sizes for clinical trials, that kind of thing. So I gave some readings, I think, that are in the packet, and I'll walk through one example, which is also in the reading that can kind of really help understand it. So what kind of information do you really need? Well, you need some information about what the benefit is of the new technology or drug or intervention, or what that new study is going to gain you. Of course, you need to know something about what is already existing. You need to know something about the value, which could be cost, but value and cost are not actually the same thing, but something about value on the opportunity loss when it occurs. And you definitely need to know something about the size of the patient population who would actually benefit from this intervention or drug or trial. So the general form of the approach is kind of a subtraction problem. You have the first term, which is the expected net monetary benefits. And again, monetary benefits would be something that comes out of the cost effectiveness, is what you would probably typically do for a cost effectiveness kind of study. Dollar per quality, dollar per dolly, dollar. Somehow you want to monetize, because that makes it much more straightforward, of course, when you're comparing to costs. So if you reduced all the uncertainty, what would be the expected net monetary benefits? And you subtract from that what you have given the information that you have today. So how is this really done? It's a simulation. So you have the A is the action that the decision maker takes, and you're trying to maximize the net monetary benefits, or the if it's not monetized, just the benefits generally. And S are your uncertain covariates. And you simulate through all these values of S and then average over the resulting values. So you need to know something about costs and benefits of the decision. Again, like I said, benefits, you can have utilities. This would come out of your SQL. And I must confess, I actually come out of the chemical side of things. I'm more of an environmental scientist. So the drug world is an interesting world. We like to watch it because we see things about safety. So for you, safety and efficacy for us is probability of effects occurring from chemicals that are already out there. So we have a slightly different spin on things. We don't actually ask people about their outcomes, but I know there are these questionnaires and things that elicit utilities and patient preferences, and it's those kind of data that go into the benefits and estimating the benefits. And then you have a dollar per quality or some other kind of cost effectiveness ratio. In a comparative sense, you don't have to get too bogged down about the dollar per quality, because I know that is a controversial topic in any event. Once you have predicted costs and these benefits, you can compare them. And of course, again, you need to know the number of patients in order to do a population value of information. So this is what a sort of an example decision tree would look like. You've got the standard of care, the standard care that you would offer. You have a new treatment. It has a probability of side effects. You need to know something about the quality, and these terms are all described in a table in one of the AIDS reading, and then something about the costs. And it uses this framework, this exact framework, which is what you would do for sort of a typical cost effectiveness kind of study. This kind of framework translates right into value of information. So an example of a question you would ask would be, what would it be worth to conduct an observational study on 60 patients who are on the new treatment? So when you go through the calculation, you get $5,550 per patient, so you can compare that now to what it would cost to do the study. Or what would be the expected value of sample information for a study that allocates 200 people to the new treatment and another to the standard care. Well, so you can go through and calculate that and then compare that to what it would cost to actually do that. So this is a whirlwind tour of value of information. I didn't go through the math because it can be a little bit more frightening, but it's certainly in the readings. So have a look at that and see how bad it is or how good it is. But these are really powerful techniques that are used to evaluate research priorities. And actually, there's a couple papers that just recently came out, and I think you probably have copies of these slides or what have you, that go through actually and provide a list of all the studies, VOI studies that have been done and the specific context, sort of the systematic reviews, which is very helpful. It describes exactly what they've done and what clinical context and all that kind of thing. So a couple of these papers are really helpful, I think, for that. So it builds on existing cost-effectiveness studies that are typically ongoing, but it, again, has this addition of using the Bayesian statistics. The downside, if you will, is that really, yeah, there's no off-the-shelf software. So it's going to require linking some models and software platforms in order to do this. There are some closed-form solutions if your distributions, all these things are described by distributions rather than point estimates. There are some closed-form solutions if the distributions are predominantly normal or log normal, but generally you would use simulation kinds of techniques, and it's really not that intractable in this era of big data and that kind of thing. And what it really offers is the opportunity to identify where your maximal benefits will be gained from the additional study that you're thinking of doing based on reducing the uncertainty in what you already know. And with that, I thank you very much for your time.